It's a 62-year-old lady undergoing microincision phacoemulsification with insertion of a crystal lens HD. We're starting off with a limbal relaxing incision. This is a 60-degree arc at 96. So here we are at 90, and that's 100, so about halfway over, 96. Then rotating so that we can use these hash marks to determine the length of the incision. So 30 degrees on each side. 1, 2, 3, here, 1, 2, 3, here. Notice I'm about 1.5 millimeter into the surgical, from the surgical limbus onto the cornea. Drying off these marks. Trying to be as perpendicular as I can be with this 600 micron diamond knife. This is the Wallace LRI diamond knife. There's a thin handle so it can be twirled easily, and just following the template of the limbus. That will correct about 1.5 diopters of cylinder, somewhere between 1 diopter and 1/4 diopter and a half in this age group. It's a paired LRI incisions, 2 60-degree arcs at 85. So here's the Mendez marker, and there's 90 degrees and 80, so 85 is here, about 1 millimeter to 1.5 millimeters in. Turning now and putting that 90-degree mark right on that mark so that I can count 3 hashes on each side. 1, 2, 3, and 1, 2, 3. So 3 marks on the cornea, and you can go ahead and mark the other side too at this point. So I'll go ahead and mark over here. There's 85. Turning slightly, counting 3 on each side. Another mark, then 3 on the other side. So now we'll have 2 60-degree arcs at 85. Dry the cornea to see the marks well. This is that single foot plate diamond. Fixation of the globe with a .12 forceps and advancing the knife toward fixation. Watching the blade as it passes through the cornea, trying to stay as perpendicular to the cornea as possible. That's 160. Now making the other incision, trying to stay as perpendicular to the corneal dome as possible. Twirling the blade in the fingertips and following the template of the limbus. You notice I'm about 1 millimeter to 1.5 millimeters in on this side because I want to place the side port diamond underneath this incision. Just a little bit more here. That completes the, you see some disruption of epithelium, an abrasion essentially, but that heals quickly, especially that far out in the periphery.